Hi, I'm Joe Scott, the President and CEO of Jersey City Medical Center. Welcome to the Medical Center Show. I'm here with Dr. Julie DiGioia, who is the Medical Director of the Cristie Kerr Women's Center at Jersey City Medical Center. Dr. DiGioia lives our mission every day of enhancing the life of women in Hudson County, and she does a terrific job. One of my favorite people.
You're one of mine.
Oh, thank you. So tell us a little bit about the Cristie Kerr Women's Center, and what are you doing there, and who's Cristie, and how did this whole thing start?
Well, we have a lot to talk about.
Yeah, we do.
I was, of course, born, raised, and educated in Jersey City.
Wow, you're a Jersey City girl.
Very proud of it.
Very, very good.
Very proud, born and raised and educated. And I have practiced in Hudson County for about 25 years now, but it was only about 3 years ago that Jersey City Medical Center, and I have to thank you specifically, was able to involve that beautiful lady, Cristie Kerr,
yes,
who's an LPGA championship golfer,
right,
and who has many charitable endeavors. But as a pro at Liberty National, she had wanted to give back to the community,
right,
and looked for an opportunity to help. And thanks to you and your wonderful team, she was informed that the county was really lacking in high-quality breast cancer imaging.
Right.
And breast cancer, of course, being one of the leading causes of cancer and death in women nationally, but certainly also here in Hudson County, it is a perfect place to develop a high-quality diagnostic center.
Wow.
And Cristie was able to enable the hospital to purchase the state-of-the-art equipment necessary for breast cancer screening as well as diagnostic, right, and interventional medicine, and for that reason developed the Cristie Kerr Women's Center, which at this point is truly the flagship of what we intend to develop as a county-wide cancer center.
Right.
So Cristie is an angel in our lives,
yes,
and you were able to guide her to us.
Well, you know, I actually had the original meeting, but it was you who convinced her that this was going to be a great thing. And she has some family history, right? I mean, she
does. She does share a history, as so many
right,
of us do,
right,
with family members, close family members,
sure,
affected. And I believe it was her mother's diagnosis which truly
right,
energized her. And breast cancer can empower people to
sure,
make a difference,
yeah,
because it can be so devastating to undergo. And for that reason, I think Cristie had a personal passion about helping women
wow,
find this disease and
right,
treat it. So that personal energy and, of course, her incredible skill and you know, fame,
sure,
is able to attract
wow,
wonderful people to help us.
Yeah, that's terrific. So tell us a little bit about your background, education, training.
Surely.
You know, you're a Jersey City girl. How did you become like the premier, you know, women's medical director for the Women's Center?
Well, I, of course, was born in the Greenville section of Jersey City,
right,
and went to the St. Al's Academy Church,
oh, wow, great,
and also school, mm-hmm, and went to St. Peter's College, our great Peacocks, yep, go Peacocks, and it was a great Jesuit education.
Mm-hmm.
I'm very grateful for it. But we were quite famous for the pre-medical program at St. Peter's. It still is.
Right.
But after college, I went to medical school at the University of Rome in Italy, which was also a wonderful experience spiritually as well as
sure,
educationally. And when I came back to the United States, I trained at Jersey City Medical Center.
Oh, great.
Under a legendary chest surgeon, Dr. Joseph Timmies,
mm-hmm,
who was really a premier thoracic and general surgeon. So he had developed a great training program. But I feel like my heart has always been in Jersey City, not
right,
only because I was born and raised here, but because my father practiced medicine in Jersey
wow,
City for 60
right,
years.
Right.
So my brother also now continues to practice at Jersey City Medical Center. So we have a personal passion.
And your husband also, right?
Well, my beautiful husband, I get to him too, but he was a resident with me in general surgery at Medical Center, and then he went to Columbia Presbyterian, the plastic surgical residency program.
Wow.
So Dr. Stephen Hall and I have been married for now going on 29 years, and he is a premier plastic and hand surgeon and with a special passion on breast reconstruction.
Wow.
So my days as a general surgeon were kind of exciting, and I loved trauma surgery. I was a trauma surgeon at UMDNJ. But when my boys came, I decided to try to kind of narrow my focus to something that I could truly throw myself into.
Right.
And that was breast cancer, and that was back in 1990.
Wow.
So since 1990, I have devoted my practice to breast cancer diagnosis and the treatment of breast diseases.
Wow. Now, So tell me a little bit about the Cristie Kerr Center and what kind of things do you do there? You know, how does it work? What's the what kind of modalities are there, or what?
Well, the Cristie Kerr Center as it exists today is primarily a very high-level diagnostic radiology center.
Okay.
And my job is kind of as queen cheerleader to tell the community what we have here, and although I am not a part of the radiology group, as a surgeon and also as a breast cancer survivor, I have an intense passion about spreading the word that early diagnosis and accurate diagnosis and accurate treatment of breast cancer should be available to all women, and regardless of their insurance or ability to pay. And that I provide the guidance to the medical staff and to the OBGYN staff and to the community groups to educate women about what is available, what is possible, and what should be done.
Wow. So women can come there and get their routine mammography? And
yes, they have a very wonderful screening program, also available on Saturdays and evenings till 7. And we have a very small but incredibly dedicated group of technicians, radiology techs, both ultrasound, mammogram, and breast MRI, who are truly deliver a personalized experience for our patients, which I think that our patients can take back to the community and spread the word.
Good. And the equipment's state-of-the-art? Is it the best equipment that you can get now?
The equipment is absolutely without compare.
Really?
And our radiologists, under the the guidance of Dr. Novick, of course, and our head breast interventional radiologist, Dr. Len Resnikoff, who is really very well known for his breast expertise, demand only the best equipment and the best supplies and the best technology.
Wow.
And we're so grateful that with Cristie's help and with the help of the community, we are now purchasing our own stereotactic biopsy table, which is really an important part of any center of excellence.
So tell me a little bit about this stereotactic biopsy. So someone has something suspicious and you step in and figure out what's going on there, or how does that work?
Well, the beauty of stereotactic technology is that it is a computer-guided type of diagnostic tool to help the radiologist or sometimes the breast surgeon target an area of abnormality that cannot be felt. And these are usually mammogram lesions that are seen either as calcium deposits or as small nodules or masses that are not able to be felt by the patient or the doctor. With this technology, including targeted ultrasound and mammography, biopsies that can be performed accurately of that area, and small clips are placed at the site of the abnormality. So once the pathology is confirmed, the patient can then have options described to her about what treatment, what surgical treatment is necessary, or indeed, if it is not necessary, because if the biopsy is benign, the patient will not have to undergo a surgery.
Okay.
So it's a very, very helpful.
So you don't have to cut anything, it's just a small needle, is that?
It's done under local anesthesia. It involves injection of the local anesthesia, a small nick in the skin, and a special kind of a biopsy device that is introduced with the computerized guidance, and of course the radiologist, to target the specific spot, take out portions of that area, and the radiologist can see in real time that the calcifications are removed.
Wow.
Then they actually x-ray the tissue that they remove to confirm that the calcifications are removed. And this gives the physician a great confidence that the area that we're looking for has been accurately sampled. So accuracy and the minimally invasive aspect of this has really revolutionized breast diagnostics, and it has taken breast biopsy out of the operating room and into the outpatient and same, sort of radiology
you do
department.
it, so you do it like in the same-day surgery area, or?
Well, the stereotactic biopsies are done in the radiology breast center, so they're done with mammography there and all the techs and the support that is there.
They don't need anesthesia, it's just a local
It's a local procedure, and then usually within a few days the pathology is available, given to the referring doctor, and the patient then is brought in for a conference.
Wow.
The beauty of our breast center at Cristie Kerr is that we are blessed with a Surgicenter also in the same building. So if a cancer is diagnosed or an abnormality is seen, we can then plan that team approach to target the clip and then do the surgery in the outpatient department.
That's great.
So this is wonderful for the patients because it kind of makes it a very personal and hopefully less stressful event.
Right. So there seems to be a lot of controversy around when women should get a mammography, and insurance companies have guidelines, and sounds like there's a lot of medical guidelines out there. What do you recommend?
I realize that there's a lot of pressure these days because of insurance issues and
Sure.
cost and possible side effects, and there's always a very vibrant discussion going on. We have to remember that mammography is proven to be the only screening modality that has decreased the mortality rate from breast cancer.
Wow.
And this is a worldwide finding.
So you mean, by mortality rate, you mean that if you get a mammography early enough and you detect it, the chance of dying from breast cancer gets reduced?
Absolutely.
Wow.
And these patients are frequently cured and are really saved by this screening technology.
Right.
No other screening modality has proven to be as successful as mammography
Wow.
in this decreasing deaths.
Sure.
The challenge is, of course, what guidelines to follow. Is it insurance company guidelines? Who's behind federal,
Yeah.
guidelines?
Yeah, they came out with some guidelines. It was,
The guidelines, and this is distressing, we have to constantly
Sure.
confront the truth.
Right.
And I always believe that the American Cancer Society represents a true patient-focused, unbiased, and unpolitical source of expertise in terms of screening in all types of cancers.
So the Cancer Society weighed in on this also?
certainly
Because
did.
the feds had some guidelines, and they
Yes.
seemed to be controversial, and then the Cancer Society weighed in, and then...
the American College of Radiology also supports the American Cancer Society.
Okay.
And it's because of that, that agreement of experts that we have decided that 40 is now the baseline, the age for a baseline mammogram, but that is in the patient with no history, no family history, no prior biopsy, no risk factors, these are the basic person with absolutely no
Right,
history.
right.
So 40 has become the baseline.
Wow.
And the American College of Radiology and the American Cancer Society agrees that mammography should be yearly after that.
Wow.
Not every 2 years, but yearly.
Okay.
So we are concerned that attempts to push the baseline to 50 are very misguided.
Right.
And
Well, let's talk about this. We're going to take a little bit of a break, and we'll be back with Dr. Julie DiGioia, our medical director of the Cristie Kerr Women's Center.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Hi, I'm Joe Scott, back with Dr. Julie DiGioia, the medical director of the Cristie Kerr Women's Center at Jersey City Medical Center. Dr. DiGioia, we were talking about guidelines for when women should get mammography, and you said that looks like the American Cancer Society and the American College of Radiologists agree that 40 is probably when you should start getting mammography. Tell us a little bit more about people who might be at risk, and how does that work, and family history. Tell us a little bit about all that.
Well, we try to be individual when we recommend any imaging on a patient with a breast complaint.
Okay.
You know, every woman at some point in their lives develops either pain or lumpiness or concern.
Right.
And because there is so much discussion about breast cancer and the fact that it is such a prevalent problem in our society, we have to be able to have guidelines that we can use for women who do not fit the no history, no,
right.
You know, young patient. Generally, if a patient comes in and is complaining of a lump, even in their teen years or college years or early 20s, we try to use, of course, common sense and get a good history, but we used ultrasound a lot, and that targeted ultrasound, because we can not have radiation for these young patients, but we can get a lot of information about the gland and what's going on.
So they don't necessarily have to go to mammography as the first thing. A young woman who has a little
something
tenderness
that they're
or doesn't,
concerned about.
right? Then you can take an ultrasound and actually use the ultrasound machine to see what's going on there? Yeah.
Yes.
Okay.
And frequently these are either benign breast tissues that are just developing, or there may be a benign type of a developmental tumor called a fibroadenoma, and these are benign tumors, but they can cause a lot of anxiety.
Right.
And if the patients they feel something, they're going to be quite anxious,
Sure.
and the doctors are too. So a targeted ultrasound is very helpful.
Right.
For women over 30, it becomes a little bit more of a challenge.
Okay.
Because breast cancer, of course, the incidence increases with age.
Right.
But unfortunately, a recent study has just been published of a national concern in advanced breast cancer in women under 40. And these are women who are not screened by mammography. And unfortunately, the incidence of breast cancer in these, advanced breast cancer in these patients, seems to be very much on the rise. In 1979, maybe 200 patients a year in the United States were diagnosed with advanced breast cancer, very rare.
In that 20 to 30 age group?
In the under 40.
Under 40. Okay.
But in 2009, it was 800 cases, and these are advanced cases, not early cases.
So we are 4 times the prevalence.
Yes. Yes.
And didn't I just see something about the Northeast having? I don't know if you saw that article. There was an article about the prevalence of cancer in the Northeast was higher than the rest of the country?
Well, I think, you know, a lot of our studies, of course, are difficult to interpret because we do have a lot of screening facilities in the Northeast. We have a lot of high-level, smart people, breast specialists looking for the disease.
Okay.
But whether or not this is environmental, genetic, toxic, lifestyle, these questions can't be answered now because breast cancer involves too many kinds of patients. The healthiest people in the world versus those not so healthy. So the concern really is more research needs to be done, and they're looking at this. But for a woman with a breast complaint over 30, frequently we will get a mammogram because, again, digital mammography and the dosage of radiation is much safer than it ever has been. And with the digital imaging, we don't have to take as many pictures as we used to. So a woman over 30, we will consider getting a diagnostic mammogram with the ultrasound.
This is somebody who's
over 30 and has a problem.
Breast self-examination, they find something. And you would then examine that person and say, okay, we think it's appropriate for you to have a mammography. So talk a little bit about prevention. Women should do breast examinations.
Well, we recommend that women should do a good breast self-examination and learn when to do a breast self-examination, which is timed around their menstrual cycle. For usually right after the menstrual cycle is complete is the best time when the breasts are least sore and least scary and lumpy. In women who have been, post-menopause, they should do it on the first of the month. And we show our patients how to do these exams, and part of our community outreach is shower cards and models and things like that, so the patients can truly understand the technique.
You know what I think we should do? We should have a special segment on this show that shows women how to do that. I think that would be great. And we'll have to bring that back and figure out how to do that. But that would be great, right? Wouldn't that be, something that would help women really understand how to do that properly?
And not be afraid.
That's the key, right?
Yes.
Yeah.
Yes.
you know, we talk about at the medical center, it's small enough that we kind of have a close-knit group of physicians who work very, very closely together, and yet we still provide the highest level tertiary services in the area. And for women or anybody with cancer, you have something called the Tumor Board. Tell us a little bit about that and how that works and who participates and what's that all about?
Well, I'm very, very proud about the Tumor Board because what it does is shows the commitment of our physicians to treating all cancers as group. And we are very blessed at Jersey City Medical Center. All of our medical staff is board certified, and many of them are super specialized in various areas of expertise.
Wow.
And our Tumor Board for breast cancer, every hospital that has the ability and the population to merit a individualized cancer care has a tumor board that consists of surgeons, plastic surgeons, medical oncologists, radiation oncologists, radiologists, and pathologists. And we discuss all newly diagnosed breast cancers at this conference and invite their private physicians to come as well. The patients, of course, are not there, but their slides, their films, their pathology is discussed in a very congenial multidisciplinary forum. And 6 months ago, I have started the same process for non-breast tumors, which is the first Friday of the month, and we're presenting our colon cancers and our lung cancers, prostate cancers, neurologic cancers, leukemias. So we are expanding this discussion because it is a team that has to treat patients.
Well, you know, it's interesting that you say that. So when somebody gets cancer, sometimes they go for surgery, sometimes they go for chemotherapy, sometimes they go for radiation. So in this tumor board, are all the different folks who could potentially touch the patient there?
Yes.
So,
yes.
And they all come together and they look at all the pathology and the history of the patient together and then decide, okay, the best course of treatment for this patient is surgeon or radiation?
First, chemotherapy first, radiation later.
Wow. That's really something.
It is a very wonderful group because all of the oncologists attend.
They do.
And we also bring in surgeons and specialists from outside Jersey City. People come from Secaucus, from Bayonne, from Hoboken, because we treat a community. It is a county-wide focus that we have, and there is a true need to have this conference because we can't have it at every place, but there has to be a place to do it. And Medical Center is the place to be if you're going to be talking about cancer.
Wow. You know, I remember when you first started this and there were only a couple doctors that come.
Now it's packed.
Now you have, somebody said there was 100 doctors at the last tumor board.
We had about 85.
Wow, you had 85 doctors. Well, you know, think about that. So you're a patient who has a tumor or some type of cancer, and now you've got 85 doctors weighing in on what the best course of treatment is. That's really spectacular in terms of you can't get that treatment anywhere. I mean, there are very few places that do that.
And you know, as the focus for cancer care in this county, it is a critical part of management. And we also have a very vibrant medical student and resident staff. We have OBGYN very strongly involved with breast cancer on the front lines. So they learn, and the medical doctors as well can learn about the new technologies. They can see the MRIs. And again, just to bring the MRI question into this discussion, remember that now we do genetic testing for breast cancer, and often in women over 25. And MRI is absolutely essential in screening women who have been identified as genetic
so let's back up for a minute. So my mom and my grandmom had, I'm a woman, and I'm not a woman, but
I know.
But let's just say I'm a woman, and my mom and grandmom had breast cancer. And so now you can then test me for genetic marker, and so how does that work?
Well, genetic testing is now available on a wide variety of basis. It's approved by all our national cancer boards, and it is available as a saliva test. It's very simple to administer, but the more important part of
what do you mean a saliva test?
It's just using the cells on the inside of the mouth.
They just take like a swab of your mouth?
Spit into a little thing.
Really?
And it's very, you know...
Non-invasive. So you don't have to take blood, you don't have to take any tissue or anything, they just spit into a
little tube, and they send it off to Utah.
Wow.
And we get very important information back. But this is most useful in patients who have young family members with breast cancer, meaning premenopausal breast cancer, patients who mother may have had bilateral breast cancer, or multiple generations, you know, sisters, at first daughters, or who develop breast cancer very young. So it's a mutation marker. And what it does is it gives us another piece of information in terms of preventing the development of the disease. Women who have this gene, and again, only about 5% to 10% at most of breast cancers involve this gene, but those women can be counseled and screened and have preventive surgeries that can prevent this cancer from inevitably developing.
Wow.
So it is another life-saving.
So, you know, we talked about women over 40 who don't have any family history. That's when they start getting mammography, and then every year after that. Women who might have, you know, during their self-examination might find something, they might be a candidate. And then what about these people with a genetic marker? Do they automatically get
They need, of course,
mammography
the young
right away?
ones will get yearly MRIs.
Oh, they will. Okay.
And we individualize mammography in these patients because, as you know, MRI does not replace mammography.
Right.
It does not show calcifications or other changes that make mammography so essential in detecting cancer early. So many of these patients will get both. But for the very young ones, we may stagger the mammos but do yearly MRIs because they're more sensitive.
Wow. Yeah.
So we have to individualize their care too, and we have to have a very careful discussion in terms of the ethics of genetic testing, in terms of privacy, in terms of patient education and family counseling.
Right. So
we link up to approved counselors for this type of family information. It can't be done in a vacuum.
I see. So once someone has that kind of genetic marker, then we've got actually special counselors who help them kind of understand what the implications of that are.
Exactly.
Yeah, that's incredible. And, you know, to think that we only started this a couple years ago, and to be able to have this comprehensive tumor board, state-of-the-art equipment, the ability to do these specialized tests, stereotactic biopsy, now genetic testing. I mean, that's really comprehensive and incredible feat that you have been able to accomplish with all of this.
Well, you brought us all into this discussion.
We did that. That's good, though.
But you've supported it, and I think that without that door being open, none of this could happen.
Yeah. And you know, Cristie, this is going to be a little advertisement. What the heck? She puts on an annual golf tournament at Liberty National. For those golfers out there, you ever want to play golf with an LPGA professional? We do it every year. This year we're doing it in July. And the proceeds go to the Cristie Kerr Women's Center.
That's right.
She's raised almost, what, $500,000, $600,000? Yeah. So, and we just bought that new stereotactic biopsy machine, so women can get all of their treatment right there in the imaging, or go up to this beautiful new surgery center that we have overlooking the Statue of Liberty. So we're very fortunate to have this comprehensive program. Most importantly, we're fortunate to have you as our medical director. We love you. You do a great job.
Thank you, Joe.
And we love having you at the medical center.
Thank you for all you do for us.
To see Dr. Julie DiGioia, please call our Cristie Kerr Women's Center on behalf of the medical center and on behalf of all of our employees and physicians who enhance life every day. We'll be back next week with our next show. Thanks.